Hi, my name is Gloria, and in 1994, there's a doctor named J. Bruce Mosley, and he's a Houston Veteran Affairs Medical Center doctor. And 1994, 10 arthritis patients came into his office to do an arthritis surgery, and but that surgery was different because he divided the groups into two. In one group, he did the original arthritis surgery, and the other group, he faked the surgery, where he just made a small incision and that was it. And the result was really surprising because both of the groups felt better after the surgery, even though the other one was just a fake surgery. And this fake treatment is called placebo. And placebo, according to the Merriam-Webster dictionary, it means that placebo is usually a pharmacologically inert preparation prescribed more for the mental relief of the patient rather than for its actual effect on the disorder. And it basically is a fake medicine, or so-called sugar pill or other treatments given to the patient to make them believe that they were cured. And placebo is also used in controlled experiments testing the efficiency of other substances, such as a medication drug. And so my position on the case is that placebo treatment is effective in healing medical conditions. And I'm gonna prove my claim with two secondary claims, which is that placebo treatment helps the minds to think positively about the health condition, which results in actual healing, and that there are multiple test results that prove that placebo treatment is effective. So my first secondary claim is that I'm pretty sure most of you guys heard of the saying, mind over matter. Placebo treatments help the mind to think positively about one's health condition, which results in their actual healing. And according to Jeremy Frank, a psychiatrist from Johns Hopkins Medical School, psychological and bodily process can be profoundly affect each other. All illness, whatever their bodily components, have implications that give rise to anxious emotions, raise difficult moral issues, damages the patient's self-esteem, and estrange him from the compatriots. I've seen many students get sick during finals week, and during my junior year, I moved from an average high school to the most intense schools in the nation. And due to the stress of studying and my SAT, I usually get over a cold in 2 weeks, but that cold lasted about 3 months. So your mental condition actually affects the person's physical condition. And Dr. Leonardo Cobb, a Seattle cardiologist, performed a popular surgery that everyone knew that it was going to work. And it was a 90% chance of success of arteries, where they tie arteries into knots so that the blood could flow to your head easily. And however, he also did another test where he did not tie it, but just simply faked the surgery, and the result was the same. And so, according to Jefferson M. Fisher, a psychology professor at St. John's, stated that respect for the source of the placebo is the most important ingredients in effectiveness. So you have to trust your doctor, and it'll actually be a successful placebo treatment. And for my second claim, there are multiple tests that result that prove the placebo treatment to be effective. Placebo, I said, is used to test the efficacy of a newly developed medicine. In 1955, Henry Beecher, a Harvard researcher, concluded that between 30 and 40% of those tests that's done on newly developed medication responded really well for the placebo side of the medication. Like 30 and 40% of the treatments of the placebo were actually very successful. And certain conditions such as pain, depression, some heart alignments, gastric ulcers, and other stomach complaints actually had 50 and 60% success rate. And that is just the placebo treatment. And so, for my conclusion, your mental condition and your physical condition are tied, where the placebo treatment can actually help your mental condition to be to feel that you're gonna be treated, which actually leads to your bodily healing. And there are so many tests throughout the years that prove this, that placebo treatment is actually effective. Thank you.
All right, the claim is clearly stated. I think you take a long time to get to it, though. It's 2 minutes before you finally get to the proposition. You lay out the secondary points. There are only a couple of points that you're setting up. Your claim is a little bit broad, and I think the secondary issues mostly suggest a description of what research has been done without necessarily making any inferences based on that. The things that occurred to me as I was listening to this, either that means that the people weren't sick in the first place, or that means that the actual treatments were not doing that much good and people were actually recovering on their own, and it's only the belief that they were recovering that influenced them. Or maybe the placebo works for some people but the surgery works for others. In any case, the question then becomes, what inference should I draw from this? Should we draw from this the inference that we should use placebo treatments more frequently, or that surgeries are being performed that are unnecessary, or that additional research into the power of the mind in solving problems would be appropriate? I'm not sure what the ultimate claim here is. Like I said, this sounds like a good research paper on a subject that's interesting, but I'm not sure what the claim is on it. You do a nice job citing examples, explaining concepts. You do provide sources for most of the things that you're talking about. I thought you did a pretty good job on that, and you spoke to us pretty effectively. Like I said, I just think there need to be some stronger inferences, and it's clear what the generalizations are.